Hello everyone, this is Dr. Zeeshan and this is
Dr. Ifza.
Hi Dr. Ifza. So recently you just recently given your first NHS interview as a non-ready job as an oncology fellow. That was the first job you being shortlisted and you got offer. So would you like to share your experience and anyone who is struggling to get the job offer in NHS? What do you recommend them? How to prepare for the interview? How to fill in the application form? Would you like to share anything about that?
I think before filling any application form, you need to go through criteria of that job. What's their essential criteria and what's their desirable criteria? And while you are filling that application, please fill supporting information according to that criteria and link everything with your own abilities. So I think it will make your application very strong. So I think they have normally NHS have some specific uh, you can say apps that normally pick those words that they specially mention in their own
Okay.
job profile. So if you mention those essential and desirable criteria in your own supporting information, so your CV or application have more chances to get shortlisted.
Okay, that could be number one thing, that sometimes that application being reviewed by the consultant as well. So they usually see your experience and how you
I
answer
think
that
experience
criteria.
matter, but I have seen lot of people, they have done MRCP 1, even MRCP part 2, but they are not even able to get a job, even they are not even shortlisted for a job. So I think the problem is that they are not they don't know how to fill their application. So they normally need to work on how to present themselves in application, so that they even if they don't have MRCP part 1, part 2, their CV
So-
should be so presentable that they get that it gets shortlisted in any.
So you mean that it's totally depend how you fill your application form along with your experience,
Yeah,
bit of
experience. Yeah, and
Okay,
normally,
but-
like in any job application, if it's related to peds, gynae, even medicine, try to link your clinical experience with that CV. So you
Okay,
need
okay,
to
that
do
makes sense.
little
And
bit
what about what's the
manipulation.
role of previous clinical attachment or ALS? What do you recommend about ALS or anything
So
like
I
that?
have done ALS recently, but I think it makes you more confident in your own self, and you know how to manage critical cases, and even you know how to lead critical cases in presentation, like in actual hospital
Okay,
setting.
right.
So I think
Do you recommend
everybody
ALS
should
or-
do ALS, and
Okay.
they should go through ALS book and other paperwork.
Yes, I think in most of the NHS job application they put a desirable criteria ALS or MRCP1 if you're applying a medicine job. But that's a good thing. What do you say about the question? What type of question they do ask?
In
Is
ALS?
that in the interview? So
I think
I believe there are two type of questions. So what do you recommend to the doctors? What type? How they
Okay,
can
so
prepare?
I-
What resources you used?
I asked most of my colleagues who has done their interview and NHS clinical jobs. So they told me normally they will ask you about your own clinical experience and some ethical questions and some critical case scenarios. They will ask you that in actual presentation, if you are there, how you manage your patient. So I prepare my interview according to these questions, and Dr. Raja Adnan, his videos are
Yeah,
also
he's quite good. Dr.
Yeah,
Ajadnan,
so,
his videos are totally free on the YouTube.
Yeah, so
and
I go.
Exactly.
So at my time, I go through all the videos of Rajadna, even some other YouTubers. They have done pretty good job.
So
in
you're
NHS.
trying to say that all the questions what you say as a junior doctor clinical interview, Dr. Ajadnan did mention there.
Yeah, he did mention few things, but you need to prepare few things according to your own job profile and criteria.
Okay.
Like normally he's not able to tell you everything, but he normally makes a proper base. You can say a layout, so that you can prepare according to that layout.
All right.
But you can like study your own job criteria, essential and desirable, and then you can mix and match Dr. Raja Adnan
Yes.
videos and other YouTuber videos, and even your own clinical experience.
Exactly.
So I think all these things will help you to prepare you for interview.
Brilliant. So, if the one last question about SGT part of question, the ethical questions. So, I do agree that you did mention a clinical for the medicine. There are a lot of books you can go through your previous knowledge. For example, you was applying for oncology, and you went through what bit of scenarios. What do you recommend
For SGT.
for SGT and for the clinical part? What
I
resources
think
you used?
for clinical part, normally I go through NHS basic guidelines, which I think easily accessible to everyone. And for SGT part, I think you normally develop it when you work in NHS setting, real life setting.
Mhm.
So when I started my career in NHS, I was not good in SGT in terms of actual clinical practice. It makes me a little bit more time to like practice in real life in NHS. Then I implement these things in my own in my further practice. So
Oh.
in my interview, when they asked me some questions about situational judgment questions, I know how to answer these questions because normally I implement these things in my.
Do you recommend any book for that, for the
Yeah, normally
situational judgment?
I think Oxford STT book is good.
Mm-hmm.
Even you can go through some foundation year program STT questions. They are
Okay,
also very
brilliant.
good.
You mentioned that your NHS career. So before your regular job, you're working in NHS. Do you recommend anyone who want to start another route like direct locum? We both of us started as a direct locum and started covering few shifts. Do you recommend doctors if they want to start, if they have the visa? Should they start as a locum as F1, F2, or?
I think if they have visa and if they are lucky enough to start their career in NHS as a locum, they should give it a go because you need to take a bold step to fix any system. So
Brilliant.
if you don't take it, you will always regret your decision because normally there's a lot of saturation in NHS these days. So if you are waiting for a regular job, it may like you need to wait it for a year or 2 years. So if you are not like if you are so much eager to start your career as soon as possible, so I think locum doctor is the best thing you can do.
Brilliant. So definitely we'll make a separate video about that. For everyone who don't know about Dr. Ifza and me both are basically co-founder running an academy for name as UK Pass Academy for IMG doctors. And today's video is basically about how to apply for the job as a junior clinical fellow or SHO, whatever the post you are going to apply. And we shared a story about Dr. Ifza. She applied. How many applications did you apply? And you shot maybe 20 or 30. How many applications?
I think 25.
She applied 25 applications. She had a bit of locum experience in NHS, not regular, but she shortlisted from one of the best hospital, and she able to get the offer letter in the first interview. That's quite amazing. But I would like to definitely will in the description we will share more of the information what the resources Dr. Ifza used and few bit of highlights from her job application. And I finally the last question I would like to ask Ifza. After that we might finish this video for YouTube because it's 8 minutes. My target is like 10 minutes video, so we still have 2 minutes. The last question, because I read your application, I was quite impressed how you presented yourself. The last question is usually trust do ask about that. Why should we choose you? So what do you say about that?
This is one of the best questions in any interview. You need to sell yourself. How you sell yourself for any job in NHS. So even if you have a lot of good experience in NHS, but you are not good to present yourself in any interview, so they will not hire you because this question is the building block of your whole interview. They will see that how much potential you have to present yourself and to sell yourself, like how much how much eager you are to start your career. So when they asked me this question, I was like, I need to.
I like one point, because if when she was taking the interview, so I was on the separate room. I was not in that room. I overheard something that she said. I'm very hardworking and few communication, compassionate thing about the patient. I love that thing. But definitely in the description, we're going to share a few of the highlights what she mentioned in her job application, the few things. And if you need any help regarding job application in getting how you can apply, how to fill in the application form, Dr. Ifza will be guiding. Me myself will be guiding, because she didn't given me any credit. It's okay. Wives always do the same thing. But during her interview preparation, I was trying to help her on few things which I applied when I was taking my first job application, and I would say that is highly recommended. Few things which we're going to mention in the description. Number one thing. Number two, Dr. Raja Adnan videos is amazing. He covered every bit of the questions, and the description about Dr. Raja Adnan videos are amazing. So guys, good luck for your applications. Keep applying, keep applying. Don't stop, don't lose hope. There are a lot of jobs in the market. You just need to find out and keep applying. Every application should be better than the previous application. Don't lose hope. Go for, there's a market. There's still a market. I know a lot of IMG doctors are there. There's a competition is high. Keep applying, and good luck. If you need any help for PLAB 1, PLAB 2, do recommend UK Pass Academy. The link is below, and we are offering big discount. We're starting interview course soon as well, and how to fill in job application, we are starting that help as well. So guys, good luck. Thank you very much. Signing off, Dr. Zeeshan.
And Dr. Ifza.
Thank you very much. Please like and subscribe. We will be doing more informative videos.